Genetic factors, obesity, smoking, men are worried about their loose direction, that is ED. Obese patients, what happens is, because of their huge weight, when they put on the female partner, she gets breathless and distressed will be there. So she starts pushing him indirectly. And this fellow has to complete the act and get rid of the act by ejaculating early, and becomes habit forming. Because that lady, poor lady, she may be about 38 or 42 kg and he is 120 kg. How can she bear that weight? So the best thing is he ejaculates. So coming to the diagnosis is written on the forehead. He himself comes, sir, I ejaculate quickly. I said, yes, come, I will treat. I will never ask how many minutes, how many strokes. Why I am bothered? He is not happy with the sex. The best thing is start treating. So all this, whatever I am telling is totally from the private aspect, not from the theoretical. If you write this answer in your examination, probably Rao sir will call you and who said this? Then you don't quote me. Because he knows only I can tell all these things. He knows it. Oh, Sharath has said, yes. So, friends, the only thing is, when you practice it, why the patient has come to you? He has come to for relief. He wants a relief. We are not here to judge you. No, you don't have premature life. You are doing it for 3 minutes. I am doing it only for 2 minutes. You are doing 1 minute more than that. No, don't do that one. Yeah, 3 minutes. Yes, it is short. Ideally, 5 to 10 minutes. Yes. So, start treating them. What are you going to lose? He has paid your consultation fee, and you are going to write the medicines. The chemist makes some money, and manufacturer makes some money. They are happy, you are happy, he is happy. Because next time he said, sir, now I am ejaculating after 5 minutes after taking that depoxytin, sir. Some wonderful drug, sir. My wife was telling, where did you get all this strength to do so many strokes? So yes, fine. So treat them. Never go and argue with them. To argue, it takes 15 minutes consultation. To agree with them, it is 1 minute. So I save 14 minutes time and treat him. What I'm going to give a prescription. He is happy, I am happy, everybody is happy. And the medical representatives will be the queue to see me because I am giving more prescription. If you convince them and say you are no, 30 minutes is 30 seconds is enough, 60 seconds, that is what the ISSM says. And you take the book and you show the Google that is 60 minutes is 60 seconds is normal. Don't argue. Just agree with them. That is the best diagnosis. And physical examination, routine investigations, special investigations will give us a root cause for the PE so that we can treat it very effectively. So what are the complications of PE? Relationship is affected. You said 60 seconds is enough and go. She will fire him and said, see, I have seen in all the videos, in that video I saw him doing the sex activity for 10 minutes. My friend told that his husband is doing for 5 minutes. Now you are doing only 1 minute and arguing with me that it is 60 seconds as per the definition. Who wants a definition? She wants satisfaction. So relationship is affected. To some extent, quality of the life is affected. Because next day, when they go out of the bed, they go fresh if they had good sex in the night. And if the sex was not good in the night, irritation starts. She brings the coffee, he says the coffee is cold. And she says that what you did in the night, that is the same thing cold, you drink the cold coffee. Couple may land up in infertility also because of premature ejaculation. Because hardly enters the vagina. And whatever is rubbing, it was only on the labia majora. 60 seconds, where is the time for him to go till the cervix? So he would have ejaculated outside and they'll end up in infertility. And the IVF specialist will take them for IVF. They make money because each cycle is 2.5 lakhs, 5 lakhs, 10 lakhs, like that. So simple treatment will make them to land up in so many problems. So person may feel lose some closeness shared with a sexual partner. One might feel angry, anxious. So many psychological factors may come once they land up in the premature ejaculation. So this is those who want to take a picture, this in a nutshell, how we see what is the diagnosis, for acquired PE, what we are going to do, for natural and variable PE, what is the treatment, and premature like ejaculatory dysfunction, premature like. So that is the last diagnosis which we always follow in the private sector. So I'll come to each one in more details. So treatment, lifestyle modification, behavior therapy, condoms, local applicants, oral medicines, other treatments, combined treatments, and surgical treatments. I am going to take one by one. Lifestyle modification, very, very important. A smoker, ask him to start smoking. A chronic alcoholic, he drinks